Hello friends, now we'll be discussing about peritoneal cavity. So peritoneal spaces, before starting I would like to thank Chandana Shri Ma'am for sharing these wonderful notes with us. These are very helpful for quick revision and you can download the notes from the link in the description below. So without further delay, let's get started. So before understanding these spaces, it will be very nice if we can understand the ligaments prior. So there are various ligaments and mesentery which create these spaces inside the abdomen. So considering these 12 ligaments and mesentery, the first one is the coronary ligament, which we can see in the diagram, which is attached from liver to the body wall and the diaphragm. The from the liver to diaphragm, as we can see in the diagram. Then we have the gastrohepatic ligament, as the name suggests, from gastric part to the liver hepatic. Then third one is the hepatoduodenal ligament, again in continuity with the gastrohepatic, the hepatoduodenal ligament. Then is the falciform ligament, that is the ligament of the liver, from the liver to the abdominal wall or the parietal. Then is the phrenicocholic, that is from the diaphragm to the colon. Then gastrocolic, from stomach to colon. Duodenocolic, from the duodenum to the colon. Then the gastrosplenic, from stomach to the spleen. Splenorenal, from spleen to the kidneys. Then the small bowel mesentery, which is in the center. The transverse mesocolon, which is from the stomach to the bowel to the posterior abdominal wall, and the mesocolon from sigmoid and the ascending colon. So these are various ligament and mesenteries. And now we'll see the potential spaces. So we have 9 potential spaces which we'll see in detail. So what are these potential spaces? So the lesser sac, which is also known as the pseudocyst, where the pseudocyst of pancreas occurs. Then the subphrenic, which is right and left, which is just below the diaphragm, between the liver and the diaphragm, and are common for abscess formation. Then the subhepatic space, also known as the hepatorenal pouch, which is the most dependent portion in the supine state, supine position. So subhepatic, below hepatic, and between kidney and the liver. So that is hepatorenal pouch. Then the supramesenteric, the inframesenteric, between the mesentery. Then the right paracolic gutter and the left paracolic gutter besides the large bowel in the colon. And in the pelvis we have the pouch of Douglas or the rectovesical pouch. So the extra peritoneal spaces around the liver, which are in the right side we have the perinephric space, in the left side we have the left perinephric space, and in the middle we have the bare area of liver where there is chance of abscess or hematoma formation. So we'll see them in the diagram. So as we can see, these are the subphrenic space, the second and third. Then fourth one is the subhepatic space or hepatorenal space. Then we have the 7 and 8, that is the paracolic gutter, supramesenteric and inframesenteric. And ninthly, the pouch of Douglas or rectovesical pouch. And in this sagittal section, we can see that anterior to the liver and stomach is the greater sac, which is connected, greater sac, Anterior to the liver and stomach is the greater sac, and behind it is the lesser sac. And between the greater sac and the lesser sac is the foramen of Winslow, which is a channel between the liver and the stomach and the greater sac and the lesser sac. And it is from the gastrohepatic ligament and hepaticoduodenal ligament. And this is the greater omentum, also called as the gastrocolic ligament. And this is the transverse mesocolon, the behind the colon. As we can see in the diagram, the liver, the stomach, the transverse colon, the duodenum, the pancreas, the small bowel with the mesentery, and the sigmoid colon, the uterus, the bladder, and the rectum posteriorly. So this was all about the spaces. Now we consider this aphorism, that is the Bernard's aphorism. Pus somewhere, pus nowhere else, pus under the diaphragm. So if you don't find pus when you are searching for it, please check under the diaphragm. And then we have the Hoover sign, where the spine deviates to the side of the subphrenic abscess. Then considering the hepatorenal pouch or the subhepatic space, also known as the Morrison's pouch, where we keep the drain in cases of intra-abdominal surgeries, many of the times. So we can see in the diagram the subphrenic space, which is connected to the hepatorenal pouch or the Morrison's pouch between the kidney and the liver, and below it is connected to the right paracolic gutter. So what are the boundaries? Inferiorly, we have the hepatic flexure of the large bowel. Then medially is the second part of the duodenum. Supralaterally is the communication from the right subphrenic space. Inferiorly, it continues with the right paracolic gutter. So it is the most dependent part of the peritoneal cavity in the supine position. So where we commonly place the drain in cases of intra-abdominal surgery or biliary surgeries generally. So this was all about peritoneal spaces, and thank you for watching. Keep studying, keep growing, and never give up, because great things take time. And see you in next video soon. Thank you.